Our research is focused on the primary prevention of cardiovascular disease and diabetes. Within our centre, we conduct clinical trials to assess the effectiveness of nurse interventions to reduce and minimise a person's cardiovascular and diabetes risk. And we also develop electronic decision support and management tools for use by nurses and health professionals to help them improve health outcomes. The primary aim of our research agenda is to reduce the likelihood of a person having a heart attack or stroke or developing diabetes. And we do this by measuring the key risk factors that cause those diseases, with a particular focus on people living in regional communities, because we know that they are at higher risk and they are living with higher risk factor levels. Key capabilities we have is in conducting large-scale clinical trials and randomised control trials. And as part of that, a big skill base that we have is in comprehensive and non-invasive risk assessment, and that is to give a person an indication of what their cholesterol levels are, what their blood pressure levels are, with on-the-spot reports once they've been profiled. We collaborate very closely with eminent cardiologists and endocrinologists from Baker IDI Heart and Diabetes Institute, as well as leading GP academics from the University of Melbourne and the University of Adelaide. We also align very closely with the Royal Flying Doctor Service and also Indigenous researchers to apply similar programs in Central Australia and other remote parts where there's a large Indigenous population. From a healthcare perspective, our wish is that we establish the evidence for more nurse-led clinics, and that will help support other health professionals to combat what is Australia's biggest killer, and that is forms of cardiovascular disease.